How many of you left your office last knowing that you dotted every I and crossed every T with your documentation?
This I want to hear about, so find out today on Medical History Mysteries.
Hey, everybody. Welcome to another Medical History Mysteries. I'm Pam Maragliano. With me, as always, Tom Viola. Tom, we talk about this a lot, that it's really important to document the medical history, medications, the treatment that you provide, recommendations, etc. But how many of us are doing it?
I wish I could say we're all doing it, but I guess it's one of those great unknowns, man. We really don't know how many of us leave the office every day and fully document the charts. In the world of dentistry, and I've learned this over the course of all this time is our enemy. We just don't have the time to do everything we'd like to do in the constraints wear on us. Things happen during the day. You've got your scheduled patients, but then you've got emergencies, you've got side appointments, you've got all this pressure and to get things done efficiently and effectively, which is great if you want to run in a very efficient, very effective practice. But sometimes time constraints mean we cut corners. And I'm not going to say I'm not guilty of it myself every so often. Everybody does what they have to do to get it done in the amount of time they have. But as I've said 1,000 times in my lectures, because I've worked on the litigation side, I can say this for sure. You have to be able to impress only one group of people on this planet with your documentation skills, and that is the State Board of Dentistry. Doesn't matter what the lawyers say, the judges say, the expert witnesses like me say, nobody cares. The only people that matter, State Board of Dentistry. The State Board of Dentistry looks at your chart and says, wow, your documentation is stellar. You did everything possible. You've documented everything you did, everything you thought, what your treatment plan was, why you made the decisions you made, why you chose that specific planning. And you reached out to medical doctors for consults. You did everything possible, and still this event happened. Well, it could not have happened because you could have expected it. As a matter of fact, based on all the information at hand, you could not have expected it because you dotted every I and crossed every T. That's what I love to hear. What I don't want to hear is, wow, your records are atrocious. You barely documented anything. I mean, you didn't even write down the name of the anesthetic you used or how much you used. Your notes are negligently omissive. Those are the words you don't want to hear. Because the State Board of Dentistry has your license in their hands. They give it and they take it away. And I can tell you from my experience, I'm no expert in that respect. I can't make any guarantees. But if the State Board of Dentistry sides with you, litigation, probably not. State Board of Dentistry rules against you, litigation, probably going to happen. And Pam, you and I know that we've had people who approached us and said things like the following. Ready? You're perpetuating myths, Viola and company. Consults aren't absolutions of guilt, and doctors, medical doctors, know nothing about dentistry. You and I both know we've heard this before, right? All I know is that medical doctor knows that patient in ways I don't. And I'm going to reach out. Now, whether I get the consult on time or, I know it's a pain in the neck. You get to speak to the doctor on a blue moon, end up talking to the staff half the time. I get it. But I'm still going to reach out. And if I don't get the consult for whatever reason, I'm going to document that I did reach out and ask for a consult because I want anyone to be able to look at my records 3 years from now and say, wow, you did an impressive job here.
Well, gosh, I can tell you if I look at my records 3 days from now, I'm not going to remember what happened. I like what I had yesterday. You know what I mean? So I feel like it's really important to take the time and do that because I know we hear it and if it's not in the record, it didn't happen. And so it's
Right.
important to do that. Now, most people who know me knows that like I'm really super into caries. And so this is a Debbie Downer story, so get ready.
Mhm.
This is one of these stories where back, I don't know, this was a while ago, but this was a case that a dentist performed a full mouth reconstruction on a patient. So crowns on every tooth in the patient's mouth. And the patient ended up in about 2 years getting like a wicked case of caries and ended up having to have multiple extractions and all the things. And so, of course, the patient just went through all of this dentistry, and oftentimes they expect it's going to last forever, which we know it's not, and sued the dentist. And so this actually went through litigation, and
Hmm.
the dentistry that was done, the diagnosis, the the preps, the crowns, like the cement, like everything the dentist did, nobody took into question. The one thing the dentist did not do was identify that the patient was at risk for secondary caries and was at risk for at a high risk for caries, and that risk management measures were suggested. And that was
Yeah.
missing. And for that reason, the dentist sadly lost that case. And so I
Yeah.
always think about that when it comes to treatment planning and documentation and maintenance recommendations and just general documentation. So I think it really behooves all of us to every once in a while take a course on documentation because we might be missing some things.
Yep. If you document it, if it's in the chart, it lives forever. No one could ever question it later. I mean, I can even say that about vital signs, blood pressures, pulses, ASA. You document it in the chart, it lives forever. No one could ever question it. But if you don't put it in the chart, it never happened. It's like you could swear up and down that it did, but it didn't. This came up in a case I was a part of with epinephrine being used in a woman who was pregnant. The dentist said, well, I did a PubMed search. I went online and I looked at all the articles that said it's, absolutely safe to use epinephrine in pregnancy. And I'm sure there are journal articles out there that say that, and I'm sure they've proven it beyond a doubt. But that never got recorded in the chart. Moreover, in my opinion, reaching out to the obstetrician is not a bad idea there because that obstetrician knows that patient in ways I don't, and maybe ways that that patient's not going to tell me. Like, has she had a previous pregnancy? Was there an episode of preeclampsia or other eclampsia or hypertension of pregnancy? Maybe the patient doesn't think to mention that to me, and I don't think to ask it. But if I reach out to that obstetrician now and I get back that consult that says, yeah, you should be cautious. I don't think you want to use epinephrine here. Wow, that changes the entire complexity of the case and changes the entire face of the case. And if there was a complication that happened as a result, again, sure, there are lots of studies that say there should be no complications. But let's just say there is one, like in the case you just mentioned. I want someone to go back and look at that chart and say, hey, you even got the consult. And I'll tell you one more thing, and I know this is, I'm raising my hand. So, see, I do that a lot. I raise my own hand. So let me lower my own hand.
We're Italian, we flap our
I
own.
talk with my hand. Yeah. So here's the one thing I do know, and in the limited experience I've had in court, most of the stuff gets settled out. If I've got a medical doctor that gets subpoenaed to come to court for a dental event, man, I sure want that medical doctor sitting on my side of the courtroom saying, well, you consulted me, versus sitting on their side of the courtroom pointing fingers back at me saying, never called me, never asked my opinion. I would have told them. And so that's why I always look at this as you don't know what you don't know. Why take any chances? Yes, you could do the PubMed search, but why not reach out and get the consult? Why not ask the patient specific questions like we've talked about in previous episodes? Be that inquisitive person that you're looking for, as I like to say, being the defensive driver in dentistry. No, try to anticipate the things that could go wrong and rule them out, and then document it so that everyone knows forever and ever you did exactly that.
Now, I'm going to have to give a shameless plug to dental economics because we have articles within dental economics on our website about proper documentation, what should be in a proper case note. And I can tell you what I do is I have templates that I use that we edit. But I feel like, for example, chief complaint, something that, seems pretty simple enough, should be in every single case note. And diagnosis. Obviously, if you're planning number two MO, one would think, okay, well, there was caries. But I actually have a section that says diagnosis. So it doesn't allow me to forget
Yes.
to fill that in. So I
Yes.
don't, the template is there just to also help me remember the important parts of the case note that I may have or my assistants may have overlooked. So definitely Do whatever you need to do to be able to document properly and completely and accurately. And I think that this is a really important message that we should be talking about more often.
I don't care if you write it in hieroglyphics, shorthand, whatever. Get it in the chart. You can always explain what it meant later, but do get it in there. And remember that if you're going to prepare for a specific patient, like the woman who's pregnant, who you may want to use epinephrine on, make sure that you document somewhere. I did this legwork. I did this research. I did a PubMed search. Whatever. I did my research. I did my due diligence because that's going to come back later. Again, if I've ever said this 1,000 times, it's never enough. I want my chart to look like I had the patient's best interest in mind when I did what I did. And that's all anybody could ask of you.
Okay, you've heard it here. My next lab note, I'm going to put some hieroglyphics in it and see how it goes.
Sounds good.
All right, everybody, for Medical History Mysteries, document your charts. We will see you all next week.
See you, everybody.